Hi, everyone. Welcome to our Facebook Live event. We're here at Christian Hospital for the BJC Nursing Conference. And we're going to jump right in, and we're joined right now with Rick Stevens, who's the president of Christian Hospital. Rick, thanks for joining us.
Thank you for having me.
We just had the opportunity to hear from you in there. Can you talk a little bit about the work that you at Christian Hospital are doing out in the communities?
Well, our Christian Hospital Foundation is sponsoring 2 school-based health centers, one at Riverview Gardens High School and the other at Hazelwood East High School, because we realize a lot of our kids are sick and we have a high prevalence rate of diabetes and asthma in North County, and this is a way of keeping our kids in school. Also, we're partnering with the Salvation Army, and we just received a grant from the Missouri Foundation for Health to provide 2 community health workers in the community in Ferguson. And so North County has the highest prevalence rate of diabetes, and so this is our way of helping people live with that disease and so they can have a normal, healthy life as well. And then also, we believe the community is ours because we're a community hospital. We've given away scholarships to high school students and also to a deserving nursing student as well who will come and work at Christian as well.
Well, that's great. And we are going to keep that community partnership theme. I'm going to introduce a friend of yours here. You want to introduce him really quickly?
Yeah, Michael McMillan, President and CEO of the Urban League here in St. Louis.
Welcome. Well, come on over, Michael. We're excited to have you here today, and thank you for spending your time with us at Christian Hospital and speaking to the group.
Thank you so much. Always a pleasure to be at Christian Hospital and always be a pleasure to be with BJC. We have a long-standing partnership that we're very, very pleased with in terms of how we get out into the community and make a difference helping those in need.
So can you talk a little bit about your partnership with BJC and specifically our Diverse Nurse Connection Group? I know they've been working very closely with you this past year.
Yes, so the Diverse Nurses Group really helps us by staffing our mobile health unit, which we take and go to those zip codes in our region that have the most issues in terms of healthcare problems with diabetes, heart disease, blood pressure, and so many other disparities, especially in the African American community. And these nurses from BJC really make the difference by getting out there with us, going into those communities, and then seeing people and doing tests and following up with them to make sure that they can then find out at an early stage if they have any problems with diabetes or any of the other issues that I just discussed and any other issue, period, and then try to get them the proper care that they need.
Well, and I hear a lot from our diverse nurses who go out and help staff the van that they really enjoy it. Can you talk about some of those experiences they have with your team?
Oh, absolutely. Our team is truly grateful for the BJC nurses, and we have heard many stories from the staff, both from the Urban League and BJC, about how they've talked to people, and they said, this is the first time that someone has ever come to my neighborhood, to my street, to really see what is an issue with my life and how you can make a difference. And some of the people have broken down into tears actually on the van because they didn't have that access before, and the partnership between BJC and the Urban League provided them with that partnership and that capacity to then have their health care needs be met.
Well, that's so powerful. Thank you so much for your time today.
No, thank you so much for your partnership, and thank you for having us.
Okay, well, thank you. So as I mentioned, we're at the nursing conference here at BJC, which is being sponsored by our BJC Diverse Nurse Connection. I'm joined here with 3 lovely ladies who are nursing leaders across our organization. I have Kelly and Teresa and Tony. And ladies, I'm going to ask you, since you are all nursing leaders here, talk about the importance of developing our nurses and providing opportunities for them to continuously learn and grow.
Yeah, it's an opportunity for us to come together throughout the system to listen, to learn, and to grow, and to always keep that dialogue open.
So, Kelly, what are you enjoying about today's conference so far?
Networking with people in the community and leaders, and just having so many people that are passionate about serving our community and our patients that we see every day.
So, Tony, I'm sure you have some people from your team and people you know from your hospital here. What's the feedback so far?
They're having an amazing day. They have been enlightened, and they are just impressed with how this has been planned and the connections that they're having.
Wonderful. Well, thank you, ladies, very much. Enjoy the rest of your day today here.
Thank you.
Okay, well, up next is a friend of mine, Tom. Welcome. Thanks for joining us. Thanks for coming on camera with us today. So, Tom, the rumor on the street is that you are going to be up on stage pretty soon. Can you give us a little sneak peek into what's coming next?
Yes, I'll be on stage this afternoon. I'm part of the LGBT Connections group, and we're going to talk about what we're about, what we are trying to accomplish, and some of the patient care issues regarding the patients of the LGBT community.
So, Tom, as a director of patient care here at Christian Hospital, can you talk about the learnings going on today and what your team's experiencing here at the conference?
Every day. We have a lot of learning going on. We're trying to get out education. We're trying to promote awareness and just the community in which we serve.
Great. Well, thanks so much, and good luck on the panel. I can't wait to see you up on stage. All right. Okay, well, next I have two of our leaders, or actually our co-leads of our Diverse Nurse Connection, and we've mentioned the Connection Group a couple of times. Stephanie and Marie, can you tell us a little bit about what is the BJC Diverse Nurse Connection program?
Marie. I don't mean me to start. So what it is one of the, am I looking at you or at the camera? It's an affinity, okay, it's an affinity group just like other big organizations have where people with like experiences can come together, share their experiences, but still be engaged with the organization they work with. So diverse nurses, come one, come all.
And what better way than to use our professional platform than to get out into our community and to serve the community and come back to work. And it's just an all-around great feeling knowing that you're a nurse in the hospital as well as a nurse out in your community. It's what we went to school for.
So I know you two both have very full-time jobs, and I know that working in your BJC Diverse Nurse Connection, which I like your shirts, by the way, very nice. I know that's a lot of extra work that you're doing. Talk about why you are giving your extra time to this group.
I personally am giving my extra time to this group because it does allow me to connect to other people that have like experiences like I do. I'm a nurse practitioner at Children's, and I ultimately think that this group full of nurses that are diverse can help impact the care that we give at the bedside. Ultimately, this will filter out to frontline staff, and our patients will receive the best care, and we'll do what BJC does, make medicine better.
I agree.
So, Stephanie, why do you think it's important that we have a diverse connection group?
I think it's important because of where the hospital is situated in St. Louis. So we're in a very diverse urban area. And if our nurses and our staff look like us or look like the nurses that are serving them, then we can better meet those patient needs where they're at.
So I know that we have, I think we have 150 people here joining us today. This is the first nursing conference that we're having, sponsored by the Diverse Nurse Connection. Can you talk about what that means to you?
What a year it has been. We started off with our feet on the ground, not knowing what this group was going to do, how we were going to impact people, but so far we've impacted many lives in the community and within the hospital as well. And the nurses and the leadership that I get to work with and I get to meet, I wake up every morning wanting to do this job. So it's made a huge impact on my life.
Marie, what would you like to add to that?
I think this conference totally exceeded my original expectation. And I think this is what we want our group to represent, all kinds of diversity. Mm-hmm. The diversity exceeded my expectations for this as well. We have white, we have black, we have men, we have women, we have LGBTQ, we have everybody represented, and that's what this group is about. This is what we ultimately want our group to look like. It's like what's in our conference today.
And look like the patient population.
Exactly, and to look like the patients that we take care of.
Wonderful. Well, thank you both very much. Enjoy the rest of your day today. Okay, so up next, we have two members of our nurse recruitment team. We have Rhonda and Jean, and, I would love to hear your perspective. So you are on the nursing recruitment team for BJC, so you recruit nurses for all across our organization, and I know that you're both involved in this Diverse Nurse Connection group. Can you talk about why it's important to have events like these, groups like these, from the recruitment perspective?
Absolutely. Rhonda and I are really excited to be here today and happy to be representing our nursing team because we have many colleagues that also work with us. Mm-hmm. Today is a great day for us to spend time with the clinicians and the nurses that we've hired and continue to build those relationships and then also meet people within the community that we can develop a pipeline with.
Yes, I would definitely say the same thing. I'm so excited to be here today. I think the connection groups have been so vital to the recruitment function because we're able to kind of cast a wider net and really network with some really, really good clinicians. So these connection groups have helped us out exponentially when it comes to recruitment.
So what have you learned? So I know that you go to some of the meetings that the Diverse Nurse Connection Group has. They meet monthly. They have different events. They do go out into the communities. We heard from Michael and Rick talk about what have you all learned during this experience?
You want me to go first? I'll go first. I'm chomping at the bit, huh? So what I have learned is that we have to make sure that we're able to be in the middle. So we post positions, and then we assume that people know about the positions to go and apply. Well, we're able to come to these meetings and find out that sometimes people don't even know about these opportunities that are available. They haven't even maybe been on our website. They don't know the process when it comes to applying for a job. So we've actually been able to be kind of in the middle to really understand what are some of the barriers when it comes to trying to fill the positions.
And then in addition, we've learned about some of the struggles that our applicants have, not only with the website potentially, but also with getting their resumes, building them. And so we've been able to partner with some of our leaders and some of the community to work on resume writing, interviewing skills, to prepare them for when they come in for an interview with us.
Wonderful. Well, thank you, ladies, very much for all your work you're doing. Thanks for coming. Enjoy the rest of your day today. So I have one last person to introduce here, my good friend Terry Hart. Terry is the manager of workforce diversity here at BJC Healthcare. Terry, welcome. You pulled off an incredible day today. I can't wait to see you the last half of the day. But can you talk about, we've covered some of the areas that we touched on already, but what else is coming and what else have we covered today?
Well, Emily, we're excited that this day came about. Our connection groups are, important to me all around. And so the Diverse Nurse Connection Group, they had this vision. They wanted to see this day. We wanted to make it happen for them. So we're excited that we're able to bring not only a learning opportunity, but they've had fun today. We have had a lot of fun.
So in the top of that fun, what's the other feedback that you're hearing from people?
I'm hearing, I didn't know this group existed. This is really great. It's been a great day. They want to do this again next year, so we will see if we can pull that off. But I think overall, people have learned that this is a way for us to connect, and that is what I like about our connection groups. It is a way for BJC team members to connect to each other and our community.
So with today's conference, we talked to Tom, and he has mentioned that there's a panel coming up. We also have a very special guest speaker coming in, Dr. Ote. Can you talk a little bit about what she's going to be covering today?
Dr. Tamara Ote actually spoke to our group last year, and she brought a lot of information to our group about consciously caring for our patients, and that's what it's about. And that's why we're bringing our LGBT group and Dr. Ote to kind of bring that out to our group, that we have patients that we need and patient demographics that we need to know how to take care of. And having, the source of truth in front of us is awesome.
So, Terry, what else would you like to share with the group? You're our last interview of this segment. Is there any final thoughts that you'd like to share?
I'd like to thank Emily and her team for helping us do this live and being here to support us today. We've had a great day, and we have more to come, so the rest of our afternoon is ready to get started.
Okay, well, I think we're just about at that time to go back in. So thank you, everyone, for joining us today. If you like what you heard and you'd like to learn more about joining our organization, please go to jobs.bjc.org and learn more about both positions that we have open and our BJC Connection program. Thanks so much for joining us today.